I'm going to show you guys how to mix insulins. With this, there is usually a fast-acting and a slower-acting medication. Please make sure that you double-check that these insulins can be mixed. There are certain medications, such as Lantus insulin, that can't be mixed with anything. So with this, the doctor has ordered some regular insulin and some NPH insulin. If you flip it over, you can see this one is clear and this one is cloudy. That's going to help you remember how to actually draw it up. So first thing you want to do is you want to mix your insulins. So I like to mix it this way. You can also swirl it around a little bit like this, but make sure whatever you do, don't shake it vigorously. That can help break down some of the molecules in it. So you always want to take alcohol and clean your tops because you never know. And make sure you follow your facility's policy on how long. I like to clean mine for between 15 and 30 seconds. Okay, then you're gonna let those air dry. Now is when you need to make sure that you look at the different medications. So regular is clear, that's your faster acting. This NPH is cloudy, that is your slower acting. When you do this, when you draw it up, you have to make sure that you avoid contamination. So we're gonna say that the doctor ordered some medication to mix, and when I draw it up, I want to put in my syringe clear before cloudy. So if you guys remember, with all of our vials, you need to put some air in, because if you don't put air in, you're gonna create a vacuum. So that vacuum will stop you from getting any medication out. So let's say the doctor ordered 20 units of the slow-acting insulin. When you get air, remember you only touch this part of the plunger or this part. You never touch this inside part because that's going to potentially contaminate your medication. So I'm going to draw up, say, 20 units, because that's what that doctor wants, of the long-acting, that's that NPH. I'm going to open up my syringe. When you put the needle in here, don't let that needle touch the medication. These needles are pretty short, so you don't really have to worry about that. But if the needle's longer, you can't. So then we're going to push that air in, just like that. Push the air in the cloudy. Then pull the needle straight back out. Now we're going to say the doctor ordered 10 of regular. So I'm going to draw up that 10 of air. And again, leave this on the table, that way you don't poke yourself. Put the air in, just like so. Now you're going to have to flip over, and now the needle should be in the medication. If for some reason you're drawing up medicine and you're just getting air in your syringe, odds are that needle's up past the medicine. So here, I want to make sure I'm holding it very cautiously. I need to be able to see all my little numbers here. And I'm just going to, remember, touch here and here only, and pull down to the 10 units. Make sure there's no air bubbles. All right, we're at 10 units. Now I will say, because there's only one medication in here, if you need to push it back and kind of adjust your dosage on this one, it's completely fine. Then you're going to take this directly off. Now, when you put this into the cloudy, make sure your finger's far away from the plunger because you don't want to accidentally push the medicine in. I'm going to push this directly in, flip it over. Now, as I start to pull back on my plunger, the medicines are going to start to mix. So if I'm not directly on the amount, then I have to start completely over. So we had 10 units of the regular and 20 units of the NPH. So that means I need to go all the way up to 30. So I'm just going to go, make sure you go nice and slow and get your exact amount. So I'm exactly on 30. Had I accidentally pulled back too far, then I would have to start completely over. That way you make sure you avoid mixing any of the regular insulin in this NPH. Take that off. And now remember the scoop method. You want to scoop your needle in here, lift it up, and you guys can see it's a little challenging because this is such a short thing, so we can scoop it using something else to kind of fish for it. And then I always touch this bottom part here because we don't want that needle to stick out the side. Okay, now you've got your mixed insulins. You can go ahead and go into your patient's room and give your injection.